Hello, this is BioBeat. We'll have to brought to you by Biotechnology Board here in Pittsburgh, Pennsylvania, where we bring life-saving innovations to light. I am Kanak Iyer, co-founder of the board, and our goal is to make Pittsburgh a hub for global partnerships in biotechnology. Over the last year, we have brought several leaders in bioengineering, biomedicine, business of biotechnology, and elected leaders all together to achieve our goal. And our guest today is a very special CEO of one of the most wonderful, if not the wonderful, Institute for Research on Women's Health right here in Pittsburgh. And to introduce him is our very own Bill Flanagan. Bill?
All right, Jack, thank you so much. Appreciate it. Great to be here once again today with Michael Annichine, who is the CEO of the Magee-Womens Research Institute and Foundation right here in Pittsburgh. Welcome. Good to see you.
Thanks, Bill. Good to see you too.
Yeah, for those folks out there who are not all that familiar with the Research Institute and the foundation, what's it all about?
Well, Magee's actually the first and the largest research institute in the United States, and probably the world, that focuses solely on women's health and reproductive biology. So at the end of the day, women's health as a field didn't even start until 1993. And in 1992, the then CEO of the hospital, Irma Gertson, started the Magee-Womens Research Institute.
1993?
Yes.
What was the watershed moment that all of a sudden made women's health a thing?
Well, it was the NIH Revitalization Act that was passed by Congress in 1993 that actually said for the first time that women needed to be included in clinical trials. Prior to that, nobody included women in clinical trials because it was more expensive. And so they figured they'd take the easy way out and just do all their trials on males, including male mice, male subjects, and then they'd translate the findings to deliver dosage based on height.
I'm guilty of that. I was a fellow at the National Institute of Health in 93. I'm telling you. So we started it.
Yeah.
We have to guys.
Well, I mean, and it's remarkable that the challenge in doing it that way, things had to have fallen through the cracks. Women cannot possibly have gotten the care that they deserve.
Well, it was terrible. We had some real adverse outcomes with drugs that were approved to be on market and had significant side effects to women that they didn't know about. And so, yes, that was what happened during the 80s. And then in the 90s, Congress came to the table and said, hey, we've got to do things differently. And they started the conversation in the right direction. But here we are almost 30 years later, a little over 30 years later, and we still don't report all of the data with sex disaggregation. I mean, last year, only 50% of all clinical trials reported the data with sex disaggregation. So we're still having combo. I still think there's a lot to be done to improve women's health outcomes.
So that is pretty amazing.
Definitely. Do you know that there is receptor differences in males and females?
Yes.
And we never even worry about it. We should.
We should.
So all the drug interactions and everything has to take that into consideration. I don't think they're doing it yet.
Yeah.
So it was like, in the old days, it was like this presumption, a guy is this big, a woman is this big.
Exactly.
So
And
she'll
they-
get this much of the meds, right? That was literally
That
like,
was it, yeah.
oh my God, that's crazy. How did you go find your way here to Magee at the end of this work?
I was doing, private equity work and I was working in industry and I had two of my best friends die of cancer. And I told my wife at the time, I need to do something more for society. I need to do something more meaningful to be able to give back. And, at that time when I was having those thoughts in my head, the board of Magee called me and said, we have this research institute. It's the largest in the world. It has no voice. We need to raise the profile. We need to make a better pitch to understand, so that the layperson can understand the value we bring to this world and how valuable, how much better outcomes can be if we increase that value, if we increase that investment. And so I said, well, I'm in. This is something, I've got two daughters I can really get behind. The work at Magee was just absolutely amazing.
We'll talk about it.
We will talk about it. Yeah.
Which is historical,
Well, it is that.
Tell you about it.
Magee has been a leader for so long. But I kind of asked them, how did your background prepare you for this particular kind of work?
Well, I think as an entrepreneur and someone that's done turnarounds and growth, I think that I was domain agnostic. agnostic, right? And oftentimes I would go into an organization and domain expertise was already in the building. The blocking and tackling was missing, the business strategy, the understanding of how to gain channel access and what to do with a brand, how to proliferate that brand in certain areas to make certain things come to fruition. And so I was able to apply some of those skills, at the end of the day. GSAA guy from Carnegie Mellon, and we learned a very broad skill set in the business world. And so, I was just able to apply some of those things. And I've been a growth CEO all my life. I like to grow things. I like to make an impact, and I like to make the world a better place. And I get the opportunity to do that every day here at Magee.
Yeah, and was growth a big part of what they hope to get out of you?
It was.
When they brought you on board?
It was, yeah. They wanted to grow the brand. We were already leading the world in our science, and yet nobody knew about us. Not in Pittsburgh.
We are going to make that happen.
Not across the street. Yeah, and now we have a national brand, and we're raising money in California, we're raising money in Boston, and we're raising money in Seattle, right? And we're telling the story that shows how we're having an impact in not only those parts of the country, but really all over the world. We've got collaborations in 20 different countries on 5 continents, and we're creating value to all of those communities by the knowledge that we create right here in Pittsburgh, and then our ability to translate the delivery of that knowledge into those local communities with local resources.
You were among the first doing this, I guess, 30 years ago. But what really sets Magee apart from similar, or if there are similar research, but other research organizations really targeting women's health?
Well, unfortunately, Bill, there's not a lot. There's only a handful.
So
there's the Brigham and Women's, there's the Northwestern's, there's the UCSFs of the world. But, I think we're talking more about women's health today than we ever have been, but it's very difficult. I think NYU, the Langone Institute, just started a women's health institute, but that's brand new, and it'll take time to develop. So what sets us apart? I think, first of all, we're not just in the Department of OBGYN. I think a lot of people think of women's health, they think OBGYN. They think,
exactly.
Of course, it's
Magee is where the babies are born here in Pittsburgh.
But we take a lifespan approach, right? We look at the pregnancy and early human development, the very beginning of life, all the way through diseases of aging, like heart disease, cancer, pelvic floor issues, and really everything in between, all the benign gynecology, all the fertility and infertility, all the infectious disease. So we really take that, we span that lifespan, and we take that departmental approach that is outside of just the Department of OBGYN, but we have researchers from all over the University of Pittsburgh that are residing at the Magee-Womens Research Institute that are focusing on improving some aspect of women's health.
So I was just talking to one of the McGowan Institute people on we are going to be doing AI and women's health at Magee in April.
Yes.
So I was saying, he's a cardiovascular person. I said, are we going to do some AI and women's health, cardiovascular health? So he's happy to talk about it. And also, do you know that, and I need to get together with Pat on this. So Carnegie Mellon Institute, CMU's, my colleague, has had an interest in PCO syndrome, polycystic ovarian syndrome, which affects 10% of the world's women. That's a huge, huge opportunity for women's health and Magee.
Absolutely.
And AI, with AI's infusion of technology into it. And so my friend, the cardiovascular surgeon, he said, oh my God, I have people who have been impacted by PCO syndrome. So we're all into it. And it affects women in terms of depression, diabetes. So we can bring all of these together for women's health.
Not to mention the economic impact of things like PCOS or endometriosis, each of which they say only impact 10% of the women. But reality is that because we don't often diagnose those things accurately, we think that the real impact might be much higher.
Absolutely.
And so what about the economic impact to those women who are dealing with that, and they have to miss work or they have to go to the doctors multiple times, right? And so all of those things add up. So yes, we are very interested in working with Carnegie Mellon and other institutions to find better ways to identify those issues and then to quickly fix them.
Definitely. Like you said.
What other examples are there? Any kind of work that Magee is doing?
I talk all the time about the big things that we do, right? We have a big thing. We have a clinical trial right now for a breast cancer vaccine. It's a phase 2 clinical trial at the hospital. First of its kind. When we started it 3 years ago, we were the first one. Now I was just at the BCRF, Breast Cancer Research Foundation event in New York City a couple of weeks ago. There's 3 or 4 of them now throughout the country that we're working with those organizations who are deploying different methodologies, but we're all honing in on this vaccine for breast cancer, which is fantastic. We are working on a blood test for endometrial cancers and for endometriosis or ovarian cancers, right?
Prevention?
Well, it's a blood test to diagnosis so that we have a definitive diagnosis because sometimes these women, on average, it takes about 8 to 10 years to diagnose endometriosis. And even at that, we have to do it through an invasive surgical diagnosis. So at the end of the day, if we had a blood test that could tell us which women were endo, which women were adeno, which women were something else, maybe PCOS, then we could get them down the right path very quickly and get them back to good health, which, is significant. Those are the big things. We have
you
hydrogel.
know your science quite well.
I do. I've been there 9 years. I've learned a lot, right? We have a vaginal hydrogel right now that actually helps regrow the pelvic floors that Dr. Moali's working on. And so it actually, it replaces what's out there right now on the market, which is pelvic meshes, right? Which don't have as great outcomes. So her team's working on that. We stopped the spread of HIV in sub-Saharan Africa by 30%, delivering an antiretroviral when a Listerine style strip can be inserted into the vagina that delivers an antiretroviral locally so that the woman can protect herself against HIV transmission. So
HPV?
Well, HPV vaccine, Dr. Edwards was part of the team that worked on the HPV vaccine 20 years ago. Okay. So these are the big things that we're doing.
Prevention. You're doing a lot of prevention.
A lot of prevention. That's where we're going with medicine. We're trying to quickly diagnose things and or prevent them from happening altogether. The other thing is, we work on lots of process improvements all day long to get deployed across the street at Magee-Womens Hospital, right? So the way women get treated now is very different from the way it was 10 years ago. A lot of that efficiency and that increased effectiveness and those better outcomes have come from the research that we're doing.
And that's what I was going to ask you about. What is the relationship with the hospital? It literally is across the street?
Well, they are our sister company. We wouldn't exist without them, right? I mean, we are one and the same in the fact that, we are ultimately putting that patient first, right? Our entire mission is centered around improving patient outcomes. But, we're 2 separate organizations, but we work together hand in hand and with the entire UPMC system and the University of Pittsburgh. I think we're very lucky to be in Pittsburgh where we have such incredible healthcare here. And we have large universities like University of Pittsburgh and Carnegie Mellon who are working together to solve for some very complex issues.
Absolutely. Now, if I may, it's a world-renowned institute. And every 2 years you have this international conference which brings everybody here.
Yes, we do.
So what do you think the impact is around our region? You think it is good, or do we need to make it even better that people know, oh my God, we have a treasure right in our backyard,
Well, I think it's fantastic, but I'm always looking for an opportunity to improve. And I think, getting the word out that we are here and we can be a resource for others in the community and beyond the community. You're right. We bring in researchers from around the globe in women's health every 2 years in our annual Magee-Womens Health Summit, Magee-Womens Research Summit. We also have attached to that $1 million prize that we give away so we can add value and highlight any research anywhere in the world that might be under-resourced that is going to move the needle in women's health. And so we've invested in some significant research over the years through that mechanism that has really helped women's outcomes improve dramatically in many ways.
And you have made a difference, right? From the time you took over to now?
Yes.
Absolutely.
Lots of growth. Yeah. I think the name recognition in larger circles, whether it be in New York City or Boston or San Francisco, where we're not only delivering results to those communities because of the fact that we develop the knowledge of women's health that their health systems deploy, but we're also having a conversation amongst lay people about the importance of women's health and why it's important for them to sort of be their own advocate in the doctor's office. I mean, the current delivery system in this country isn't set up for women. Women weren't researched. The protocols weren't developed for them.
Oh,
And so they have to understand that when they go in there, they're going to be at a disadvantage almost 50% of the time. I believe the numbers say 64% of the time women will be disadvantaged in the current healthcare system versus their male counterparts who are only disadvantaged about 10% of the time.
You should be running
Well, I'll be working. We work hand in hand with the NIH to change those things, right?
Of course.
But I think the answer is we need more research.
Yeah,
we need better
definitely.
understanding.
And
You know,
support
with only
system.
30,
all of that.
better support system, a larger investment. I mean, you know, the NIH will invest about 13 cents on the dollar historically in their ASLs. Yeah, that's 51% of the population. That gives birth to 100% of our future, and they only get about 13 cents.
Yeah, it's astounding.
That's a tagline. We need
That's
to
right.
put it out there.
Yeah, you think about it. I mean, we're fortunate here at Pittsburgh in our region. We have a Magee, we have this activity,
Yeah.
we have these great healthcare systems, especially in a metro of our size. There have to be many places in the United States where women don't even begin to have access to the kinds of.
So Iyer is going to change that, right? You think?
We're trying.
It's
I mean, that's the
medicine
goal,
and all
right?
that.
We want to not only develop the knowledge here,
Uh-huh.
we want to deploy that knowledge nationally and internationally in those places where it doesn't exist. But that takes dollars, right? That takes effort, and that effort needs to be had globally and locally. And I don't think everybody understands the real need for that effort. But you're absolutely right, Bill. I mean, there's parts of this country that are OBGYN deserts. In other words, a woman will have to drive 2 hours to have a baby because there's no OBGYN department where she lives because they don't make as much money as some of the other departments in the health system. So they get cut first. We are lucky here. We have a Magee here. We have a UPMC here. We have a University of Pittsburgh and a Carnegie Mellon. But those places don't exist everywhere. So I think it's important for us to continue to spread the word that women's health matters, and we have to do a better job in all communities of understanding that and being able to invest in that so that the women of not only this country, but around the world have access to healthcare innovation.
Beyond access, well, what are the big issues or the big questions that remain to be answered when it comes to women's health?
Well, I think, like Kanak said, first of all, women are different than men. They're not just small men. So, a lack of an understanding of how drug delivery impacts women or how diseases even impact women differently. I mean, we look at women's health now as anything that impacts women differently, disproportionately, or exclusively, right? And differently would be like heart disease. It impacts
Alzheimer's, autoimmune disease,
disproportionate
depression,
autoimmune disease.
you name it. Whole list of it. Yeah.
We have a concussion study going on right now that we're working with the Chuck Noll Foundation on. The concussions actually impact women and men different, right? Its recovery time is different. The symptoms can be different, right? And so these are the things that, we, to some degree, we don't know what we don't know in all areas yet because we haven't studied it.
Exactly.
And that lack of investment is leading to a lack of return, right? We have undersized the markets. And so innovation isn't going to those places where industry doesn't believe the market size are big enough. And so the dollars don't flow in there. So there's lots that we need to do to play catch up here. And it all starts with research. It all starts with a better understanding.
We are so lucky to have you running the institute. I mean, the passion that you bring to what is needed to be done is amazing. Thank you. So,
is this a passion that's grown as you've done this? I mean, you kind of came into it a little cold, I would think.
Well, I came into it as a business guy.
Yeah.
Exactly.
And now I've learned the importance of
science,
what we do, of the
right?
science.
Yeah.
And what I learned is that the science needs more attention, and we need to put more business behind it. We need to get it to market. I think, when you look at what basic science has done over the years, it's created a lot of knowledge, but without that translational or that clinical component to it that needs further invested in, that knowledge may not get to the marketplace. And so it's important for us to sort of put the business and the science together. And I've become very passionate about that because I've seen the improvements. I've seen the, outcomes or the survival rates in breast cancer go up. I've seen the invasiveness of treatment come down, right? So I've seen the impact of what we have invested in, and I know that there's a lot more that we need to invest in.
Yeah. One of the raps against Pittsburgh is that we have this incredible research R&D capacity in the region. What are we, top 10, top 6 center?
10,
for NIH investment. And yet relative to other centers of health and science research, Boston or Stanford, we don't get the degree of economic development activity, the spin-outs, the startups that those other regions do. Is that something we can do a better job of? And do you see, Magee playing a role?
I think so. Absolutely, I think so.
Yeah, I think absolutely we can do a better job of it. Like I said, I think we can always do better. We're always looking for opportunities to do better. Magee has played a role in that and will continue to play a role in that. I mean, we open up our doors to all of the innovation activity that's going on in Pittsburgh, and we try and get them connected with our scientists to create things that maybe don't exist yet, or maybe just need a little improvement on what does exist to make it a better product or a better outcome for patient populations. We also bring in others from outside of Pittsburgh to see what we're doing. I think that's important. I think Pittsburgh needs to do a really good job of marketing itself. And I think we've talked about this for years. This is a known deficiency of ours. We don't market ourselves well enough.
Pittsburgh, we don't brag here.
We don't.
You keep your head down, you do the work, you deliver results. But we don't celebrate it as much as we should.
We need to. Can I talk a little bit? You tell the story of Pittsburgh 40 years. I'm going to tell a little bit of my story in neuroendocrinology and reproductive endocrinology. 40 years ago, I came to this town as an immigrant. And the first person I met was Tony Plant. And why? Because I was a research fellow at Indian Council of Medical Research, which is like the NIH. And I was doing research in women's health. We were doing ovulation in women with menstrual disorders, one of which was tuberculous endometritis. Tuberculosis was very prevalent in India, and so these are women who had endometrial tuberculosis who couldn't have children. So we studied the HPG axis, the hypothalamus pituitary. I'm giving you a little lecture in neuroendocrinology. Please bear with me. So that we were studying and found that these women, if they could have a surrogate carry the baby, they could. So it was such a stigma in a country like India not to be able to bear children, So we showed them we could do this. So I came here. The sad thing was I didn't have my Ph.D. By the time I would have come and done a postdoc with Tony. But it didn't happen, and I had trouble adjusting to, cultural differences. What do you call it? What is the word? Cultural shock.
You had culture shock.
I was a huge culture shock, and I didn't know what I was doing. And then finally, I got my act together, and then I said, okay, I need to study neuroendocrinology. So I went to study neuroendocrinology in this lab. My mentor was one of the duel. It's called the Nobel Duel. This is a book on the race to discover the structure of LHRH, luteinizing hormone, releasing hormone bill. This is the hormone in the brain which tells the pituitary secrete the hormones, tells the gonads to do estrogen, testosterone, whatever, and then that's how the whole cycle goes, reproductive endocrine cycle. So my mentor was involved in it at University of Pennsylvania. Pennsylvania has played a huge role in this whole thing. These guys won the prize, but my mentor was one of the running. And Tony Nobel, Tony and I think it was his boss, he did his postdoc with Ernest Nobel here at the Primate Institute. Do you know where that is? You should know. Come on, Bill. You know the whole of Pittsburgh. You should know. It's in Houston,
Yes, I do.
The Primate Research. I've been there. And then he used to show how they used to do surgery to see what was triggering the puberty, the cycle starting at puberty, right? So Tony Plant was doing all this, and I went and visited all of these people. Then I said, you know what? The reason I did reproductive endocrine work in India was to stem the population explosion. It didn't happen. Today we are still the most populous country in the world. But coming to America, I said, no, we don't need all that. So I wanted to study the neuroendocrine system in the brain. So when I went to McCann's lab in Dallas, I told Dr. McCann, I don't want to study LHRH. Too many people are working on it. The gall of this woman fresh off the boat, and then she's telling me. So he said, all right, don't worry about it. You can study the heart peptides, the atrial natriuretic peptides, gut peptides, the sleep peptides. Take your pick. What do you want? So I chose to study the sleep peptide. And the funny thing is, the first time the trigger happens, and Tony knows, this happens in the sleep cycle. Because all the neuroendocrine rhythm is linked to the sleep cycle. So it's very necessary to understand the sleep cycle if you want to understand the hormonal rhythmic patterns. So this is all the story of Pittsburgh's role, and Ernie Nobile found the pulsatile release at the Climate Research Center, Ian Tony plant. And the reason why it's important, because it sensitizes the pituitary. And all of the health, women's health, men's health, all revolves around that finding. You should have won the Nobel, he died. So you don't get posthumous praise. Okay. And I did meet Ernie Nobile when I was in Dallas. So there's a huge history here. So I've told you my story of the neuroendocrine.
Quite a story.
It is. Yeah. Pittsburgh has played a huge role in reproductive endocrinology, and we need to tell the story. And that's what we are going to do with the women's health, AI and women's health.
Yeah.
And we are going to do a satellite on pioneers in neuroendocrinology, which will be all this Ernie Nobile and Tony Plant's story of how they discovered the pulsatile release of LHRH and the whole scientific story behind that.
I just wonder, Kanak brings up this story. And what other stories do you think are untold? Things that make your eyes pop when you're meeting the folks there, and that would be that just folks outside the hospital, outside our region, just have no clue of what they're doing.
Honestly, Bill, I go to work every day excited because I get to support some of the most brilliant people in the world doing the most amazing things. I mean, just the breast cancer vaccine alone. I mean, is that the next Jonas Salk, right? I mean, are we going to, the Tom Starzls of the world, right? The Pam Moallies of the world who are developing this pelvic mesh and this vaginal hydrogel that will allow our body to regrow things. But those stories go on and on. I mean, within the system that is UPMC, there's a lot of those people doing a lot of that work. And I think it's amazing to be part of it. And I'm not a scientist, but I can do my part.
You know a lot. I can vouch for it. And the thing is, just like let's talk go. You know that Genentech, the cDNA for LHRH, they made a lot of money out of the whole thing. It should have been in Pittsburgh. So we need to keep all the money here, not let it go somewhere else.
Genentech's a great story.
Yeah, there you go. You know it.
Pittsburgh, who wound up building an incredible company on the West Coast.
Yeah.
And the challenge for us collectively is, how do we keep these brilliant people here? How do we make sure their businesses grow? How do we capitalize everything they're doing at the foundation?
I think it starts with investment. You have to make the investment, right? It's hard when there's not enough investment being made here. They will find it somewhere else, right? That good innovation, that good technology, that market ready stuff will find its way to the market because it's adding value. And we've got to do a better job of understanding how and when and being able to make those investments early.
I do get the sense that there's greater interest in Pittsburgh now than there was. I just wonder, have you seen a change in the 9 years that you've been here doing this work?
Yeah, and before I did this work, I worked in the innovation space in Pittsburgh at the Life Sciences Greenhouse and was part of that group that did invest in this type of innovation. And so, yes, I've seen the community continue to grow over the years. I've seen us continue to attract outside investment into the region. And I think we're going to continue to do that. I think what's going to happen in the next 5 years will probably significantly outpace what happened in the last 10. Because innovation is moving that much faster right now. And this confluence of biology and AI that we have in Pittsburgh uniquely positions us to attract the best of the best from around the globe. So
absolutely. You hit the nail on the head. That's what is good. I've been telling Bill for the longest time that AI and healthcare is going to put biotech is going to be what Steel did in the past for Pittsburgh is going to do in the future. Am I right?
I agree. Yeah.
And we're seeing that kind of technology, those kinds of approaches being adopted here, or at least pioneered here as well.
Yes, absolutely. We're working with Carnegie Mellon, we're working with Stanford, we're working with MIT to bring that AI innovation into the healthcare space. And we see it being delivered every day in a more rapid pace, right? What we did with AI 6 months ago was minuscule compared to what we do with it now. And what we do with it in 6 months will be even greater. So it's moving rapidly.
Yeah, right.
So as an entrepreneur and a business person, can we attract all the guys who are going to leave New York to come here with the increase in
Well, I would vouch for it. I mean, it's a great city. I mean, I'm not from Pittsburgh, but I settled here. I went to Carnegie Mellon, and that brought me here, and I fell in love with Pittsburgh. The people are great.
I agree.
The cost of living is still good. I think the innovation in the healthcare system and all of that, culture is fantastic. Yeah, please.
I agree with you. This is the last place I would have thought I would live in. I'm from Bombay, India. It's a big city, you know. Now, are you kidding me? 1 week in New York, I'm ready to come home. You know?
That's right.
I would think it's no secret there are big questions about the degree to which the federal government is going to continue to support medical and scientific research on this feature. Does that make the work you're doing at the foundation and the Research Institute even more important, given that uncertainty? How do you shore up everybody's confidence that we can do all the things you're so excited about?
Good question.
It's a great question, Bill. It's been an extremely challenging year, and I've spent a lot of time in D.C. this year trying to educate, Congress and the Senate and those that are making these decisions on why it's important to continue to make that investment in the future of this country. You have to invest in healthcare. It's what made us a world leader in innovation in this country. It absolutely makes what I do at the foundation side so much more valuable because we have to raise the money from somewhere. If it's not going to come from the federal government, we've got to get it from other sources. And we're trying to do that. But there's a big gap to fill if the federal government walks away because they fund about $48 billion a year worth of research in this country, without which we wouldn't have the innovation we have today that has extended our quality of life and extended our life.
Well, and so some people believe that philanthropy somehow will offset it. But one of my favorite statistics is I think last year, total philanthropic giving in America was $600 billion, which is a lot of money. Mostly from individuals, but foundations and corporations. But if you just look at the budget of HHS, it's $1.7 trillion. So, an organization like that takes a serious haircut, a reduction in their budget. It's very hard for philanthropy to make up those kinds of numbers.
It is, and you have to think of where they're taking it from because there's only so much to go around, right? So if they're going to invest in research now, then are they not feeding the homeless? Or what aren't they investing in, right? And I think that's important to understand. So philanthropy plays a critical role in the journey of innovation in this country, but it can't play the whole of it. And I think that's important to understand.
Yeah, and in Pittsburgh, we're really surrounded by plenty of evidence of what 60, 70 years of investment, especially in life sciences research, can achieve, all the way back to Joe Salk.
Yeah, exactly.
So as you said, Bill, that we don't brag enough, do you think we can do something more of that? From here locally?
I think we're trying today, right? I think we're trying to tell our story in a way that makes sense, right?
Yeah.
I think we have to connect the impact of that investment in research to the outcomes of patient populations, not only here, but around the globe. We have to tell that story. The reason that, we go to New York and talk to the Breast Cancer Research Foundation is because they invested in that breast cancer vaccine that we're working on here at Pittsburgh. That's outside money coming in. They see the value in us doing that. We need to tell more stories about what we're doing outside.
I can give you the economic numbers on this discovery of LHRH and how that whole thing, how Pennsylvania has played a role in global economy of this.
Yeah.
Let's put it together and show what Pittsburgh has contributed to the world.
Let's do it.
Well, that's just one example. And beyond that, I guess we should, kind of wrap things up. I just wonder what you're thinking about what the folks listening to this podcast, what they can do. What can they do to support your work, your mission? I know they can write a check, but beyond that.
I would love for them to write a check. But beyond that, I think it's important that they tell the story. I think it's important that they be their own advocate in the doctor's office. I think it's important that they ask questions about what's happening in the space of medical research as it pertains to women's health, right? What are those innovations? How are they being delivered in my community? And if they're not, then how can I bring them here? What can I do? So what you can start by doing is following us, Magee-Womens.org. Follow us somewhere and get the right message out there. There's a lot of misinformation online. You want to cut through that noise by getting the right information in the hands of the women that need it most. And so help us tell that story. Help join the conversation. And I think that's step one. Step two is help us then raise those dollars. I mean, we want to put those dollars to good use. So we want to make sure they don't get wasted. We want to make sure they go to organizations like ours that are getting an ROI on that investment. So that's probably what we need to do.
Well,
So did we do the first job right today?
well,
Telling our story?
We're helping you chip away at that.
Yes, you
Anyway,
are. I
nothing else.
appreciate that. Thank you.
Michael, I think, congratulations on the incredible work
Yeah.
that Magee does.
Yes.
Your contribution to it over the last 9 years after changing industries to do it. And we really appreciate your time today.
I appreciate being here. Thank you for letting me tell my story.
I second everything you said, Bill. And as always, thank you so much. Thank you, Michael, for coming. Greatly appreciate your time. Bill, thanks always, as always. And let's keep rolling and making Pittsburgh a hub for global partnerships in biotechnology with Magee-Womens Health Research Institute right here in Pittsburgh.